Hello and welcome to another lecture from CyberMD. This lecture will be covering Brugada Syndrome as a part of our Common EKG lecture series. Please be sure to like, comment, and subscribe to our content so that we can continue to provide free medical education resources to students around the world. Let's dive in. Brugada Syndrome is a rare genetic heart condition that is characterized by abnormal electrical activity in the heart, and it can lead to sudden cardiac death. Brugada Syndrome is caused by mutations in genes that regulate the electrical activity of the heart. These mutations result in an abnormal electrical pattern, which can cause the heart to be in a dangerous rhythm. This condition is inherited in an autosomal dominant pattern with instances of variable expressivity and reduced penetrance. The most common mutation is in the SCN5A gene, which affects voltage-gated sodium channels. However, calcium and potassium channel proteins, as well as desmosomal proteins, have also been correlated with the disease. Brugada syndrome is estimated to affect around 3 to 5 in every 10,000 people worldwide, with a higher incidence in Southeast Asia. It is also more commonly found in men compared to women, and it has not been yet found in pediatric populations. The exact pathophysiology of Brugada syndrome is not yet fully understood, but it is somehow linked to the alterations of ion channels causing improper depolarization or repolarization of the cardiac myocytes. Again, it is somehow linked to the alterations of ion channels causing improper depolarization or repolarization of the cardiac myocytes. Patients with Brugada syndrome may have a history of syncope or palpitations. It's also important to consider a family history of sudden cardiac death or known Brugada syndrome. Furthermore, despite these serious presentations, some patients may be completely asymptomatic. Diagnosis of Brugada syndrome is made through an EKG, which can reveal a specific pattern known as the Brugada pattern. Other diagnostic tests, such as a cardiac MRI, may also be performed to confirm the diagnosis. The Brugada pattern on an EKG is characterized by a complete or incomplete right bundle branch block with a ST segment elevation in the right precordial leads. This pattern is unique to Brugada syndrome and can help diagnose the condition. Again, that's a complete or incomplete right bundle branch block with an ST segment elevation in the right precordial leads. Unfortunately, there is no cure for Brugada syndrome. However, there are various treatments and management options available that can help reduce the risk of sudden cardiac death. These include medications to control heart rhythm, an implanted defibrillator, and lifestyle changes such as the avoidance of triggers that may increase the risk of arrhythmia. It is important to differentiate Brugada syndrome from other conditions that can cause similar EKG patterns, such as ischemia, pericarditis, myocarditis, bundle branch blocks. This differentiation is necessary in order to provide the appropriate treatment. The prognosis for patients with Brugada syndrome can vary greatly. Some patients may live a normal lifespan without experiencing any significant cardiac events, while others may experience sudden cardiac death. The risk of sudden cardiac death can be reduced through proper treatment and management, so it is important for patients who have known Brugada syndrome to seek care from a healthcare provider. The main complication of Brugada syndrome is sudden cardiac death, which can occur without warning and is often the first manifestation of the disease. It is important to be aware of this potential complication and again to seek treatment. These patients need to seek treatment if they have a known family history. In conclusion, Brugada syndrome is a rare genetic heart condition that can lead to sudden cardiac death. If a patient has a known family history of Brugada syndrome, it's very important that they follow up closely with a physician to make sure that they are not having any complications. That way they can improve their prognosis for these patients, for themselves. Again, thank you for tuning in, and we would greatly appreciate if you liked, commented, or subscribed to our content so that we can continue to provide these free medical education resources to students around the world.